So let's go ahead and get started talking about ethics. The ASHA Code of Ethics from 2016 is our current Code of Ethics, and we have the Assistant's Code of Conduct, which is relatively new, which was written and adopted in 2020. And these codes are really the beacon that guides our practice. So if we think about beacons far off in the distance, they'll show us a general direction we should head. A beacon doesn't really provide us with specific instructions, like is there a bridge we need to go across, or do we turn left or right at the stop sign? And similarly, these codes are not going to address every situation that we encounter as speech-language pathologists, but they do guide us through any situation to keep us upright and on the right path in our supervision. So they really form kind of the basis for our decisions. And many times when you encounter an ethical dilemma, the first thing you do, I shouldn't say many times the first thing you do, but when you encounter an ethical dilemma, the first thing you should do is go to your Code of Ethics and now the Assistant's Code of Conduct if it's related to assistant level practice, and look at those codes to see which principles and rules or fundamentals apply to your situation. And that's going to help you generate questions that you should ask about your specific situation to get those answers, and then that will guide you toward an ethical solution. I would also say that frequent consultation to these codes is what you need to guide your daily practice to bring you safely into that area or harbor of high quality service delivery and respect for everyone who you work with, your clients, patients, students, their families and caregivers, and your colleagues. If you turn to ASHA's Issues and Ethics Statement regarding speech-language pathology assistants from 2017, you will see that it says, and I quote, "It is the supervising SLPs and not the SLPAs' responsibility to design and implement a supervisory plan that protects consumer care, maintains the highest quality of practice, and documents supervisory activities." So when you work with a speech-language pathology assistant and you provide that supervision, you do need to be aware of the fact that the responsibility for determining how much supervision and what type of supervision that is provided that responsibility is with you. It requires you to be performing ongoing assessments of the speech-language pathology assistant to verify their clinical skills, their administrative skills, their conduct in the work setting, and their technical skills providing speech-language screening and therapy services, and to adjust that level of supervision depending on the level of skill shown and the needs of the clients that you and the SLPA are serving. You, as the SLP, will maintain full legal and ethical responsibility for all of those who are served by the assistant. And we can't stress that enough, that anything that might be an issue in the services provided by the SLPA, you need to be able to take responsibility for. So in order for you and your SLPA, who you are supervising, to engage in ethical practice, you need to know each other's codes. As a supervisor, you need to know the assistant's code of conduct, and the assistant needs to know what is in your code of ethics, because there are some differences. And if you know each other's codes and you engage in a cooperative effort to maintain ethical practice, you'll be able to assist each other and really provide kind of a system of checks and balances with each other to maintain the welfare of the clients and patients and students who you serve. In terms of identifying ethical violations and reporting them, you can't identify whether that SLPA who you supervise or maybe another SLPA team have engaged in some sort of unethical practice unless you know that other person's code of ethics. One thing also that I really appreciate about both the Code of Ethics and the Assistant's Code of Conduct is that they address how you should work collaboratively with each other to address any potential code of ethics violations and to resolve those situations when it's possible. And then if that fails or isn't possible, that then you inform the Board of Ethics. So I think we become fearful of ethical conversations because we don't want to have anything reported to the Board of Ethics. But our codes really promote us working together to maintain ethical practice and to resolve ethical issues before we need to report to a board.